Hello and welcome. Today we're diving into a condition that affects the lungs, often linked to a specific environmental exposure: pleural plaques, related to asbestos exposure. We'll explore what they are, how they develop, and what can be done about them. Pleural plaques are almost exclusively caused by the inhalation of asbestos fibers. Asbestos, a naturally occurring mineral once widely used in construction and manufacturing, breaks down into tiny, airborne fibers. When inhaled, these fibers can lodge in the lungs and trigger a cascade of events leading to plaque formation. The risk and severity of pleural plaques generally increase with the duration and intensity of asbestos exposure. Let's break down the pathophysiology. When asbestos fibers are inhaled, they reach the pleura, the lining surrounding the lungs and chest wall. The body initiates an inflammatory response to these foreign particles. Over time, this chronic inflammation leads to the deposition of collagen and other proteins, forming thickened, hardened areas on the pleura. These are pleural plaques. These plaques are usually located on the parietal pleura, which is the lining closer to the chest wall, and tend to spare the apices at the tops of the lungs and costophrenic angles at the lower corners of the lungs. Pleural plaques are a relatively common finding in individuals with a history of asbestos exposure. The prevalence varies depending on the population studied and the level of asbestos exposure in their environment or workplace. Industries such as shipbuilding, construction, insulation manufacturing, and mining have historically been associated with higher rates of asbestos exposure and, consequently, pleural plaques. It is important to understand that while common in exposed individuals, pleural plaques themselves don't automatically indicate a life-threatening condition, but rather serve as a marker of past exposure that elevates the risk for other more serious asbestos-related illnesses. Often, pleural plaques are asymptomatic, meaning they don't cause any noticeable symptoms. In some cases, especially with extensive plaque formation, individuals might experience mild chest discomfort or shortness of breath. However, it's crucial to remember that these symptoms can also be caused by many other conditions. The presence of pleural plaques alone does not necessarily correlate with the severity of symptoms. Diagnosis of pleural plaques typically involves imaging techniques. Chest X-rays can sometimes reveal the presence of plaques, appearing as areas of calcification or thickening on the pleura. However, a high-resolution CT scan is more sensitive and specific for detecting and characterizing pleural plaques. This imaging modality allows for a detailed assessment of the extent and location of the plaques. Pulmonary function tests are typically normal with pleural plaques alone. Pleural plaques are not typically classified into different types based on specific pathological features. However, they can be described based on their location, e.g., parietal or diaphragmatic, extent, g, localized or widespread, and presence or absence of calcification. There is no specific treatment for pleural plaques themselves, as they are generally benign and do not directly cause significant health problems. Management focuses on monitoring individuals with a history of asbestos exposure for the development of other asbestos-related diseases, such as asbestosis, lung cancer, and mesothelioma. Regular medical check-ups, including chest imaging and pulmonary function tests, are essential for early detection of these more serious conditions. The most effective way to prevent pleural plaques is to avoid asbestos exposure. This includes implementing strict safety measures in industries where asbestos is present, such as proper ventilation, the use of respirators, and safe asbestos removal procedures. Public awareness campaigns play a crucial role in educating individuals about the dangers of asbestos and the importance of avoiding exposure. Many countries have banned the use of asbestos altogether, which is the most effective preventive measure. The prognosis for individuals with pleural plaques is generally good, as the plaques themselves rarely cause significant health problems. However, their presence indicates past asbestos exposure, which increases the risk of developing other more serious asbestos-related diseases. Therefore, regular medical monitoring is crucial for early detection and management of these potential complications. Current research focuses on improved methods for early detection of asbestos-related diseases and the development of more effective treatments for these conditions.